So,
Well, we have to do it by line item though.
all right, so I'll move, transfer from contingency into delegation meeting fees in the amount of $600.
Second.
We need separate votes on it. Yeah. Okay,
Motion to, what was the dollar amount?
600.
600. All those in favor?
Aye.
Opposed? Unanimous. Meeting notice. How much? This 133, that covered 2 meeting notices.
So you'd have the full mailing for the commissioners. Is that out of our account? When the commissioners notice goes out for our meeting?
Your notices when we have to mail to the full delegation, is that what you're talking about?
Yeah.
That comes out of here. Oh, actually postage, it will go to postage, right? So that doesn't, what are these meeting notices? Just paying the newspaper, right? This is just for posting your ads. So I don't, what do the ads run roughly, Jamie? Do you know? $65 each.
So 150.
So we can do what I have.
So we'll have the
Budget.
1 or 2 delegation meetings plus perhaps 4 executive meetings. Those can all be at the same time. Perhaps 3.
So how much did you say?
And this available 133 probably doesn't include what was spent for tonight's meeting.
Probably not.
So I'll move the addition of $200
I'll second that.
from contingency into meeting notice.
All those in favor?
Aye.
Opposed? Unanimous.
Travel looks like it runs a bit higher.
Well, I figured the net, and I did it at 130 miles round trip, right, at 18, which would be high. That's 6 times 18.
Yeah.
Times 30. Be like $300 a meeting, and that would be on the high side because most people come less than that.
So we want to add 300. All right, I'll move from contingency $300 into travel.
Second.
All those in favor?
Aye.
Opposed? Unanimous.
Representative Powell.
Yeah, I'm sorry.
That's all right. I just want to mention regarding your transfer into legal services here, that at some point, the delegation had agreed or decided we were not using this legal line anymore. And it shows here only because the last time it was used is 2018. So next year it would drop off it wouldn't have to show anymore because it's been no activity for many years. So the idea was that legal funds, all legal expenses for the county, regardless of what department, are being assessed in one line item, the legal expense line under admin. So I'm just throwing that out there for you, that adding your $20,000 into that line. So if you want to make a transfer, But if you transfer it here, it just is gonna cause us to hold this blank line for 4 more years.
So you're saying that it should be under 53,200 under county administration, legal services.
Yes.
So can I make a motion then that rather than put the $10,000 into 53,200 under the county convention, we put it to 53,200 under county administration? I'll make that motion.
I'll second it for discussion.
So, where was that come from?
So if, I mean, the thing is we have legal services right now under county admin with a surplus at the end of the year of $8,000. So why would we move $10,000 in there? We would only need an additional 2. to Make it to the 10. So let's go that up.
Unless the administration thinks there's other legal services that they're gonna need between now and the end of the year.
But this was printed today.
You know about it by now.
That's fine, that's fine, I can amend it to, just to make it $2,000.
Rick, so
So I think the administrator would probably point out that some of that $8,000 might be the 10,000 for the department that is excess, so that brings them closer to not having a lot of excess in their that department. Just FYI.
For what assurance do we have that it won't be used for something other than?
So you said there was a decision made not to use a legal service line for the county delegation. When was that made?
I don't.
that was my last one.
I think it was 2 years ago.
Yeah, I don't remember when it was made. I just know there was an effort, a reason to consolidate and not have legal services in 2 places. And as to the dollar amount, at this moment in time, I don't see that there are no pending cases ongoing that I'm aware of, so I don't anticipate us spending much more in legal.
Well,
And as long as you don't cause that bottom line to go over.
Yeah, so, follow up. So based on this, then, and we're gonna be meeting again in early December if we had to do another meeting. So it's not like, there isn't another chance to make them
To do another transfer.
correct.
So,
But it seems to me to make more sense from a perspective of transparency that we continue to carry the line item for legal services in the convention. It's the convention that's being sued. It's not the county administration being sued. It's the convention being sued. And that's what we voted on to hire this law firm for. So I would just like to continue to keep the $10,000 in the county convention legal services, and the accounting system just have to adapt to it.
I mean, it's,
We've already
it's an
voted,
open line, so.
we've already voted to put the $10,000 transfer into legal services under the county convention, which is the defendant in the lawsuit. I'd like to leave it there.
Anybody else have comment on that?
is that a problem for administration?
So do you want to withdraw your other motion?
Yes.
I don't think we've seconded that.
It was,
Oh, I second.
this discussion, yes.
I would vote for myself.
Thank you.
Right, county attorney.
This will come up again when we look at transfers.
Transfers, yeah. So I guess, I don't see anything other than what's already in transfers to, everybody okay with county attorney moving forward?
Will we
When are
discuss
we
this?
gonna address the request for transfer?
After we're done with the.
Oh,
Okay, so.
okay.
ask the questions then. Okay, perfect.
So we'll force the county attorney to sit through my letter review, right?
Well,
Okay.
that's how the agenda was put together. I mean,
County administrations might be one, yes.
we can amend the agenda. So close to the end of the year, basically, we're just gonna do a, for those who've done two, budget reviews, went to legal qualifications for the year. Just gonna do a brief tonight to see if there's any other issues. And we'll move forward. Information technologies, okay. Finance office. Okay,
Finance office is close, we looking like that's a reasonably accurate 1,600 extra. Gonna be okay.
I think they will just barely, I think that'll be okay, yes.
I have a question on information technology.
oh, sure, what's your question?
New equipment. Why was that line over by $6,700?
Because there was extra remaining in another line in the system upgrade. And the need was for more to continue our 5-year replacement program, which was not funded this year. So once we realized there was gonna be money available in the IT system upgrade, then the decision was made to spend it on new equipment, which would allow us to stay within the total budget and upgrade all of our equipment.
Follow up?
Yes, thank you. But the reason you're staying within budget is because you put a transfer of $8,000 in there into the system upgrade, which you then had over. So we approved a transfer for the upgrade. And you took that transfer money and used it for something else that wasn't approved.
That's right. It was approved by the Board of Commissioners.
I got that. I don't want to do that.
All set? Finance office.
Excuse me.
Still doing.
Thank you, Mr. Chair. I have a question going back to what Representative Comtois raised here. So we've approved a transfer request previously for IT system upgrade, line item 53435 in IT, $8,090. And we're saying that that was spent on something else other than IT system upgrades.
Yes.
What was it spent on?
It was spent on computer replacements because we've talked about this many times, but because we're turning over 1/5 roughly of our computers every year, we expect to get 5 years out of them. And this year, we didn't have enough money appropriated to replace all of them. And as we had to have people working remotely, it was more important than ever that we be able to replace their computers with laptops so they could work remotely. So this transfer was a carryover from last year. There was a purchase order entered to do I don't remember if it was a risk assessment or some kind of security audit. But because we ended up doing one through Primex, we decided we didn't need to spend more money to do another one. So that left a surplus. In addition, there was more of a surplus because Mainstay paid for a part of a project that we had appropriated money for. So we had a significant surplus in that line item. And as we knew, we are held to the bottom line of every department, and there was a significant surplus, and we had a great need for computers. We asked the commissioners if we could go ahead and spend that money, and they said yes.
And to that point, Mr. Chairman, it was the opinion of the Board of Commissioners that technically computers fall under the IT purview.
Why do we have so many people working? Who's working?
Well, it varies at different times. If things come up, an employee tests positive, the coworkers will work remotely. That employee might go home and work remotely. People are sick, they can work remotely. I mean, it depends on the position, obviously, but
Most of our employees are hands-on.
most of our employees are, right? But there are 8, there's 12 who work in the 2 hallways who can work remotely. All administrative assistants can work remotely. I don't know, there are a handful of positions, countywide, probably 24 who can work remotely at different times.
Okay. So this transfer was really not needed.
It really wasn't requested. It was a carry forward from last year. So it's something that was on order at the end of last year. It isn't a transfer that we came and asked you for.
Okay.
It's just the way the system shows it as it was transferred into this year's budget. But it was actually a purchase order on order last year.
So we move on to
Yes.
finance. I believe you had a question of business order? Finance?
Did I?
Well, yeah, I think your question was, is there a high number of 1,600? Did we get an answer for you?
It's the best estimate we have right now, and I think it's reasonable.
Registry deeds? Comments? Seeing none, we'll move on to county manager. Oh boy, he took the wrong page. Going back. The question was,
Yeah, so, just curious on the other improvements. Was that a specific job that was not done, not going to be done?
Yes. The culvert, there was $12,000 appropriated for the culvert, a culvert at the end of the road that will not be done this year.
Is that going out for bid to be done next year, rolled into the project, or is that eliminated?
It will go out to bid, and the plan is to pay for it with ARPA funds, ideally, next year. The price has gone up a lot, I guess, more than double, and Dustin couldn't get anyone to do the work even if we had the money, so that's what we pushed off until next year.
any other questions on county manager?
I think when we look at contingency, we can put 1,100 out of that.
Right now, it says nothing.
Well, just earlier tonight.
I'll figure out the actual amount, yeah.
I can't print retroactively.
Was that 11?
11,100.
Sheriff's Department.
So, communications equipment, only 36% spent. Is that a project that was not done? Or, I guess that's repair. Yes.
Mr. Chair,
Yes,
Right.
Sewer.
this budget of expenses for the sheriff's department does not include the ARPA funds that we approved for allocation for a new system for the sheriff, is that correct?
Correct.
So it's not in reference to that line. That is more of a line that's designed for if any of our tower equipment does go down at this point, that's not covered under the maintenance agreement. In other words, we have 30-year technology that's on the top of these mountaintops. So if a Quantar or a repeater goes down, we would have to pay cash for that in order for them to replace it. And because the technology is so old, that's why we have that much money in the account in the event that something does break down, or computer screens or anything else within a dispatch center that's communication related, cables and wiring, the gooseneck microphones that are like $500 a piece. Anything like that is what gets replaced with that equipment and repair. And whatever's not used gets returned back to the county. So, yes.
Just a follow-up question. When are you gonna get the new system?
So the new system right now is currently in development. So they're actually continuing with their design process right now. And we're working with the state to make sure that the design is going to fit the backbone that the state has implemented. I'm supposed to be getting the propagation maps. I was supposed to get them later on today, but they didn't meet that deadline. So hopefully tomorrow I'll be getting the propagation models, which is basically the coverage that they're saying that we're going to get with the implementation of this new equipment. So this year, our goal is to get all the equipment ordered and in place, getting ready to be put in place. And then following next year will be where they're starting to get everything in and then up on the mountaintops. So this is going to be a year-long, at least a year-long project. So there's no quick fix. Everything is made to order. So Motorola does not have just a warehouse of parts and things that we're looking for. So when we make the commitment to actually purchase the equipment and we're happy with what it is that they're telling us that they'll put on these mountaintops, then once we make that agreement, then that's when we'll follow through with making the first payment, which is the $500,000 of ARPA money from this year. And then, of course, we'll follow up the first of the year with new ARPA fund requests, and that'll be based on what the total cost is going to be for the project.
Thank you.
So this new equipment we're buying now, is this gonna be compatible with the new system?
Well, so some of it is and some of it's not. So what is in that line, and I can't remember, I think it's 12,500 is what was budgeted. I could be mistaken on that, but I think that's pretty close. So that right there was more of an insurance policy, if you will, that in the event that something did break, we have the money available to go and purchase it, because these items are not readily available. They're not stocked on a shelf somewhere. They actually have to go and find these things. So if one of our towers broke down right now, no, there's a possibility that the equipment that we would purchase will not be compatible with the new system. But you're also looking at $12,500 worth of equipment versus the $1.8 million worth of equipment that will be replacing it. So there is a small factor to that. It's almost like getting a flat tire on a car, that has that the tires are half used. You're not gonna, you're gonna replace one tire, knowing that the other three are still halfway done. So that's kind of where we're at.
I was referring to the NextLS new equipment line. There was a $6,500 budget and you're projecting overspend it by 14,000.
Yes. Yep. And that would be for an IMC or an actual two new servers that support New Hampton Police Department coming on as a regional effort for our records management system. This right here is the catalyst to start for the regional concept for integrating our IMC systems, so other departments can actually reduce their budget with that, and then we can reduce our personnel costs as well, because they actually don't have to send their logs. All the data that's being entered into the system is being entered into one system. ultimately, if you can picture each officer from every department that we currently dispatch for, New Hampton is a perfect example where we dispatch for them full-time. Each shift, one officer has to take 1 hour of his day and retype all the information that we've already typed into our system here. They retype it into their system there. So that's 5 hours out of each officer up there that's rekeying their information, where they're no longer going to have to do that. It's directly imported into our system here. So it's a regional effort for this. So we had some.
Why is the county, being burdened for the cost?
Well, because the county actually has some of the burden as it relates to personnel costs to give them all the data and everything that's associated with this. So this is actually a positive effort to start reducing the costs of all the towns that we dispatch for. This is the first step in that process of getting these departments to tie into our system as that regional concept. So in essence, it's going to save the entire county eventually all this money.
So basically, when it's fully implemented, you're going to be freeing up Belknap County Sheriff's Department personnel because they're not going to have to be retyping this stuff.
Some of our dispatchers will not have to send all that information out in a secondary process. And then the officers that work for these local departments will not have to come off the road to retype all their information in. It's one consolidated system. So they'll be able to basically log in from their police department and they're logging into the servers that are hosted here at the county. And they have all the data that's associated with our dispatch taking that information in.
Follow-up. So is it fair to say that this will enhance public safety in the region?
This does. And Belknap County is one of the last counties to actually implement this process. So we had an opportunity with some of the savings within our budget currently that we thought that this would be a good opportunity. And New Hampton also has done the investment as well. So they're paying for their portion. So this is a shared cooperation. And we need one department to start this process in order for the dominoes to fall for the rest of the county. So that was the plan behind that.
Thank you.
All right. Representative Comfort?
Thank you. So based on this, once you implement this, then every other town in the county can sign on to this?
We will be giving them the opportunity to buy into their portion of this. So there is a cost that's associated with each town that wants to come on board. So it's not completely free that the county, I mean, I'll be more than happy if you people allow me to spend the money and put it into my budget. I will take every department on and put it into our server because it only makes sense. But that's not the way that our budget processes work. So we're investing our portion of it because it affects my personnel, and we're asking them to invest their portion because it affects their personnel. So it's a cooperation.
So there will not be any additional cost to this, even to add on other towns, correct? It's a one and done deal.
So we have already implemented our portion of the cost that would be associated through Belknap County. So now, because our server is now primed to be able to intake these other agencies, they will buy into their portion of the servers. Now, if you had seen the ARPA fund requests portions, I had actually implemented that into my request for my department for consideration that the county would take this on as a county project and that we would invite any town or city that wanted to be involved in this process in Belknap County, that the ARPA funds would be used for that. This is a global project.
Any other questions?
I have
One,
For the sheriff, yes, no, on another line.
another line? Okay, what line are you talking?
Vehicles. So I noticed that there,
$17,920?
right, but we transferred $23,000 into that line item.
Yes. That was yep. Oh, sorry.
And it looks like you're gonna have a surplus.
Yes. So in 2020, at the beginning of 2020, once the budget was passed, we ordered 2020 Cruiser. That was for last year. Ford could not deliver that 2020 vehicle. So the funds, which were almost $25,000, were carried over into this year with the intent that Ford would deliver. So we did order it in 2020. They didn't deliver. So in 2021, they finally delivered the vehicle. When they did so, we paid them with last year's funding. And this year, they said that they would not collect the additional funds because that's not how Ford Credit works. So when we took possession of the vehicle, that's what started the lease process, the 3-year lease process. So we have $17,920 that are in that account. That was for that same 2020 vehicle that we received in 2021. That is basically just sitting there.
Thank you.
Any more on the clerk? Cody, you have a question?
For the administrator, what's the staffing level currently at the corrections department? The fully staffed, short?
I think they're down by 1 right now, but they're in decent shape.
So the extra 100,000 was because of previous vacancies during the year? In the full-time wages?
Yes. Yeah, there was a period of time, he was down 5 or 6 for a while there.
Do you happen to know what the current occupancy level is?
I don't know. I'm not sure, I'd be absolutely guessing.
I guess 56, I think was the last number I heard.
It's low.
Representative Silver.
Thank you, Mr. Chairman. Looking at medical services contract, where we transferred $23,000 in there, it looks like we've spent $341,735. What's going on there? That's the medical services contract line item 53502 in corrections.
I know, that
This is a deficit of $380,500.
that's the line for the new, the privatizing the medical services in the jail, so, I'm not sure what the transfer is, though.
I believe we were told that by going this route, it would actually be a savings about
There is a small surplus, and it's savings on our employees. We're saving money on employees, medical services, MAT. There are many lines throughout the budget that are experiencing surpluses because of this line. Not to mention payroll taxes, retirement, all the nurses we had before. We no longer are employing nurses in the jail.
the year-end projection is only $9,000.
Yes,
Cutting it close.
but it's a
Cutting it
surplus.
close.
Right. Any other questions or corrections? Road of Justice. Questions?
Yeah, I did, is there a reason, so we have part-time wages, it looks like there's gonna be surplus, are they fully staffed, are they, you know, what's going on with that?
Well, they're not fully staffed because the delegation eliminated his 4th position last year. He has now 3 positions, and those 3 are full, but they have turned over during the year, so it was vacant for a period of time.
Health and Human Services. Okay with that one? We'll move to there. Debt service.
Question.
Question, Mr. Silver?
What's the $13,350 for professional services under debt service?
I can answer that.
Me too.
Well, originally, we were putting everything under interest,
Okay.
including the legal portion. So when we were trying to calculate interest, we really couldn't calculate it
Got it.
truly because they put the legal, fees in that also. So at least now we know what the legal fees are versus what the actual interest is.
Follow-up.
Follow-up.
Does that mean that we issued additional bonds or additional borrowing that we had to use lawyers for this year?
Yes, the tax anticipation notes require bond counsel. And we also have a financial services company that actually sells the bonds for us.
Understood. Thank you.
Capital projects. Hope we're gonna get all our capital projects done this year, huh?
So, I guess a question on that, on the arbor projects. Only $5,000 is encumbered, and $1,051 is spent. Is that money gonna be spent this year, or is that gonna roll into?
I know some of it will roll into 22. The compensation study won't be completed until May of 2022, so that we won't make a final payment until then. Can't remember what else. I think it's likely some of it will roll into 2022. I'm not sure how quickly the skylights in the nursing home will be done. I think some of it will roll into 2022. The biggest part is that 500,000. So once we get a contract underway for the communication towers, we'll pay them probably right away.
Why do we have this premium pay in the upper, under capital projects?
Was that for the nursing home people?
The reason they're here is we didn't want to put them under, separate it all out throughout the budget into departments because for one thing, it would distort your comparison year to year. They're not gonna have this every year, and just the accounting for it would be a lot more difficult if it was spread throughout the budget. We wouldn't be able to find it easily. So it was put all here. So we separated the pay, the premium pay, because it's payroll and that will be easier for us doing W-2s and all of that, reporting on the pay versus the actual projects. So it's in two lines, but they're in one place.
Thank you, Mr. Chair. But if we wanted to get an accounting of what departments were paid with this, you would be able to print that out so we could find that out, correct?
Yes.
Any other questions? Nursing home debt service.
Just a quick. Thank you. So the interest portion, that's, you're confident with that surplus there?
Yes.
Nursing home administration. So
Looks like the IT system upgrade project is the same as for the IT budget.
Yes.
So that was,
Any other questions? questions on this?
Thank you. Dues and subscriptions are up by almost $5,000 over the budget after a small transfer. What's going on there? Are they joining more things?
I don't think they're joining more things. That $60 was a carry forward from the year before, billed something that was on order. Let me just, I think it was the Association of Counties that was cut by the delegation during the budget process and was paid anyway.
Any other questions? Nursing home maintenance? Sylvia?
Full-time wages is way down. Is that absence? Is that replacement personnel at a lower rate?
It's absence. There's, we've had someone, at least one out a lot of the year.
Dr. Kumar?
Thank you, Mr. Chair. I noticed that building improvements is overexpended by 40,000. Can you explain why?
Yes, there's going to be it's called an Apollo bath. I can't tell you exactly what it is, but a bathtub of some sort for nursing home residents, which is being purchased out of there.
And what is the purpose of that?
That would be
Yeah, I don't know a lot about the bathtub itself, but it's needed for the care of the residents.
Sylvia?
So short-staffed and yet we're going over budget by 17,200. Maybe there's no transfer request?
Well, there was a building improvements transfer.
That was a part of our transfer.
That was,
That was carried forward.
You have a question?
Yeah, I mean, how can you go over on building improvements by $40,500 after a carry forward or whatever you call it, if it's in the transfer column, without a transfer request to move that expenditure? Explain that to me, how that works.
I think that's just a plan. That was a tentative plan to put that 40,000 against that line. It may not go there. Was just something at the last commissioners meeting that was discussed, that they ought to buy that Apollo bath this year because there's a significant surplus in the nursing home as a total. So it has not been actually spent, ordered, or charged anywhere yet. And now, as you're looking at it, that's probably not the best place to put it unless there's to be a transfer request. That just hasn't been discussed with the Board of Commissioners yet. Yes, Commissioner Comtois, that 52,000, 53,000 was a carry forward from last year.
Good readings.
Any other questions on nursing home maintenance? Rehabilitation. In line on that. Question?
so that, but going to nursing service,
Dietary services. sanitary services.
Dietary services, yep.
So it looks like we're gonna have a surplus of $20,000. Is that due to the, residents being low?
Yes.
Are you confident with that number?
It's the way the numbers are, I don't have, that one, I don't wanna give you so much. That's what it looks like right now. That's the best I can say.
Follow-up?
Well,
So are we at, capacity for residents as far as, Shelley is concerned? I
As
mean,
far as staffing numbers, we are past capacity.
Okay, thank you.
You're welcome.
nursing services. Yeah,
So full-time wages in nursing, we're only over by 80,000 for the year. And seems to have been a difficult time to fill positions. How does that work out?
We're under by 80,000, is that what you mean?
Yeah, but the staffing has been difficult.
Right.
To fill positions, so I assume that there are many positions empty
Yes.
during the course of the year. That line was extraordinarily high to start with.
No, it wasn't. And we've had a lot of turnover, a lot of vacancy. There's still a lot of vacancy. This line would be a lot bigger, but for the incentives that we're paying, trying to plead with people to pick up extra shifts and work doubles whenever they will. And we're paying incentives for them to work weekends, to pick up shifts, to not call out sick.
That's drug that offer.
The ARPA money is not even in here, that they're also
But I
getting
mean,
that,
they're getting that additional money plus the other money.
yes. No, it's been working really well. In some respects, it works great. The nursing home employees have the opportunity to work a lot and make good money. The problem we're running into is they can make more money in other places without working a lot and without doing this kind of physical labor. So I think that is the struggle. There are employees leaving the workforce entirely because they can't find childcare, so, or if they can, it's so expensive, they'll just stay home. They're going to work at Walmart, Walgreens, delivering pizzas at Domino's, to making more money than we can pay them. It's a serious problem. Right now there's a severe shortage, and this vaccination mandate has just about sealed the deal on the nursing home. She's trying to figure out what she will do on December 5th, when there's not enough staff to take care of the people we have here.
There's no question, the federal government has made a mess out of this country. Moving on.
Just another question in that department, please, Mr. Chair.
Yep, go ahead.
New equipment, it's over by 20,000.
That's, once. Let me just look it up and see what that is. It could be.
Mr. Chairman, well, I want to add on, I'm not trying to pile on here, but it looks like in new equipment, there was nothing budgeted. But 2,285 has been spent, expecting to spend another 17 and change, go over to about $20,000 with nothing budgeted. How does that happen?
It is for the kiosks.
They just go out and buy it, group it up.
Oh, okay, that makes sense.
Well, what was purchased is the kiosks that the nurses use to enter the electronic medical record information. They started breaking, and they are not under warranty, they're beyond their useful life. And so the nursing home administrator came to the board of commissioners and said, I need these now. And so we put them where we believe they would best be described, which is new equipment for the nursing department. And although there was zero appropriated there, the nursing department has obviously, $740,000 surplus. So that's where they put it.
Which but basically does that not require a transfer request?
No, I don't believe so. As long as we don't exceed the nursing services total, then there wouldn't be a need for a transfer.
What I have a problem with is when we got sold this kiosk deal, we were told these things were gonna last for 10 years. I believe it's only been maybe 5.
Yeah, I don't know that, but I know they didn't last and they are required.
One more follow-up.
Which is, obviously, that issue needs to be addressed in the budget proposal for this coming year.
Transfers within line items within the
Well,
department.
if this equipment is breaking down prematurely, and we're gonna have to get more kiosks and something, let's put it into the budget and let's not have it showing up here as some sort of, as a negative.
And I'll verify the useful life. I don't know what it was. If you can look at that and make sure that's.
I mean, every hospital uses them, and so I understand what the issue is. Okay.
So good.
I'd just like to note that oxygen seems to be adequately funded with $12,000 extra. Nobody's being denied oxygen in the nursing home, just in case anybody.
Not yet, we're saying something else.
It's like if there was an issue.
The year's not over.
Taken.
Bring some oxygen here to this meeting.
All right, we move on. Laundry.
I'll just,
Representative Silver.
I'll note a huge savings in health insurance, and one of those things that is insane about wage policy. Obviously, someone in the full plan went away and someone was knocked out. Yeah. Radical swing for one person. $25,000. Just a note. And the fact that saves that department from being overspent.
Roads cover that. All right, anything else on laundry?
Housekeeping.
Housekeeping. Questions or concerns? Physician pharmacy. Okay, there. Home activities. And last but not least, hairdressing. Now, this is printed out 11/16,
That's today.
right? So are these all current numbers? That- or are they
11/11, as it says, year-to-date expenditures, 11/11.
11/11?
Correct, so
So we're.
it's been another week of
5 days.
expenditures that are not captured in here.
That's as of last week's payment.
87%. Really out of line. Where we at? Carried. All right. Any other questions?
Yeah, just to note that we have 1.2 million, looks like surplus, plus there's probably another $500,000 that's gonna roll into the fund balance. But on the other side, there is $1 million, 1.1 million short on revenue. So we will be adding to the fund balance at the end of the year, it looks like. You calculated an estimate on that?
I haven't calculated it, but based on these numbers, I think it's like something short of $500,000 would be added.
And then there's the unanticipated from ARPA. That'll be another addition to fund balance.
I'm not sure, the unanticipated, you mean what's not spent in the ARPA money that appropriated already? If that's included in these numbers already, but as being spent, so it will roll through fund balance for a minute and then be transferred into next year's budget. That ARPA money will, all the purchase orders by the end of the year, so it will basically be encumbered and transferred into next year's budget.
Okay, so
Believe it or not, I would like to just compliment the staff of the county for producing this kind of surplus in a very difficult year for everyone.
Thank you.
Believe it or not, I said
Pass
that.
that on.
So it's gonna hold your growth rate.
okay. Now, the transfer request. Thank you for waiting.
No problem, thank you.
Folks.
This is better than going to the dentist, right?
We tried to move things along for you.
That's all right, that's all right. I can take that seat. Can I begin? Do you want, please? Am I ready to leave? All right, thank you, folks. I'm here from the county attorney's office to request a transfer from the contingency fund of $33,665, which we have presented to you. That comes out of, that's a result of two basic areas in my budget where I anticipate I'm going to go over. First area in my budget is the medical examiner line. As you know, I don't have very much control over the cost of the medical examiner. It all depends on how many people die in circumstances where the medical examiner feels that an autopsy would be appropriate. If the medical examiner comes out and feels like there are questions about how and why this person died, they go ahead and schedule an autopsy. When they do that, pursuant to the statute, the county has to pay for it. Every year, we basically try to guess how many autopsies are going to be performed in the county, and we budget appropriately. If you recall, I believe I'd asked in this budget this year for $18,000 for medical examiner. You all, which I completely understand, had chosen to cut that down to $15,000. But as it turns out, we're going to exceed that. We've already spent over $14,000. We have 2 months left. I know that there are more bills rolling in. And so I've asked for additional $2,000 for medical examiner. And if you'll recall, when we talked about this at the budgeting time, when I raised this concern, I believe the answer I've been given from you all was, well, that's what the contingency fund is for, which I appreciate. And so we are here to ask for that $2,000 for that. The other approximately $31,665 that I'm asking for is for some unanticipated costs arising from one of my key employees who has decided to take her retirement this year. So Brenda Alonzo, who's sitting here next to me, is my office administrator. She has worked for the county for 24.5 years. She is the most dedicated employee in my office. She has been a vital part of my office. She has an institutional memory of what goes on in my office, of the cases that have been handled over the years, of the procedures and processes. I would not be as successful as I am in my position were it not for Brenda. When I came into this office 5 years ago, she was instrumental in my success, and she continues to be. I knew she was planning on retiring at some point in the next year or two, but she had to move up those plans because her mother-in-law, and she can address this if she wants, if you have time, her mother-in-law became sick. She lives in Florida, and Brenda has to move down to Florida to help care for her ailing mother-in-law. She would like to retire as of December 31st this year. Under the contract with under the union contract, she's entitled to a payout of her accumulated vacation time and a portion of her sick time. And that is where this entire $31,000 is coming from. She has a lot of accumulated sick time and quite a bit of accumulated vacation time. So that's the $25,000. When you pay out that, you have to pay the accompanying payroll taxes and retirement on that. And so that's where that $31,000 comes from. I know there's been one issue that was raised about a waiver that was given by the commissioners, and I can explain that to you if you'd like. Under the contract, employees are generally entitled to 30% of their accumulated sick leave time. However, if you have worked many years for the county, that number gets bumped up. And if you've worked for the county up to 24 years, you're entitled to 50% of your accumulated sick time. However, there's a provision in the contract which says that if you want that higher amount, 50% instead of the 30%, you have to notify the county prior to November 1st of the year before so that the county can try to budget for it. Basically to avoid this issue, right? You want your employees to tell you far enough in advance that they're going to retire so that you can budget for this amount of money. As it turns out, Brenda had planned on waiting until later to retire, but suddenly when her mother-in-law became sick, she had to try to retire this year. So that there's also a provision though in the contract which says in exceptional circumstances, the commissioners can waive that requirement. The requirement is you have to tell us you're retiring before November 1st of the year before. I went before the commissioners. I explained the situation to them. I explained to them how important Brenda has been to my office, how many years she has worked for us, and then I asked them to please waive that requirement and to allow her to get the full 50% of her accumulated sick time, even though she's retiring in the same fiscal year. The commissioners granted that, and I understand there's been some question about whether that's appropriate or not, and I'm here to tell you I think it is appropriate, and I think it's the right thing to do. If you were to deny that, if you were to say, no, we're not going to do that, then what that will mean for Brenda is she will have to wait to retire until January 31st, another 30 days, which is a hardship for her. She wants to get down, she needs to get down there to help take care of her mother-in-law. So if you deny this, what you're saying to her basically is to get this additional money, which you're entitled to, from the county that you've worked for 24 years, we're going to make you work for another 30 days, even though you don't want to. And if she does work those 30 days, she will be entitled to it under the contract. There'll be nothing anybody can do to prevent her from getting that money. I'm asking you to please grant this full amount, including the waiver from the commissioner's office, because I think she has earned it. And Brenda, I don't know if you want to say anything more.
Yes, I mean, like he said, I've worked here 24 and a half years. I've loved my job. I've taken my job serious. I mean, I live in Rumney. I travel a long distance. In the 24 and a half years, 3 of those years I've used a sick day. You know, I've been very dedicated. I don't like to use sick time. I've never used taken a day off because of snow. I had many white knuckle rides, but I've made it in here, and because I think it's important. I think the job at the county attorney's office is a very important job, and everybody needs to be there. During COVID, when everybody was sent home, it was the county attorney, deputy county attorney, and myself that ran that office and, you know, risked ourselves because we couldn't shut down the office. We had to still deal with the public. We had to deal with the police departments dropping off
discovery to us. We had to deal with victims coming to us. We hadn't been vaccinated, but we still carried on. I wanted to make 25 years. That was my goal. I don't want to stop at 24 and a half, but my mother-in-law has cancer. She fractured 2 vertebrae. She can't care for herself. My husband is an only child. We're it. We can't bring her back here to New Hampshire. The vertebrae, it would not be a good ride for her. The cancer, it's not healthy for her to do that, and Medicare would not cover her here in New Hampshire. So we have no choice but to go down there, and she needs us, and she needs us now. Right now, my husband's there trying to take care of everything, but we both need to be down there to help her out. And so I would like to be able to retire at the end of December.
That's all I have. Thank you.
You want it for another 30 days, because we can fix that.
Well, I didn't want to retire at all. I mean, I was very unhappy that she's retiring when she is.
Was she 14 when she started?
Thanks.
Do you have someone?
Everything's over.
I'd like to make a motion that we approve the transfer request as requested.
Well, I want to discuss the transfer, that's what you have to.
So we have a motion, is it seconded?
Okay.
Seconded, now we can open up the discussion.
I don't believe we should take it out of contingency. I believe we should take it out of nursing home services, which has a huge surplus of $740,000.
So I just want to point out that, as I understand it, the difference here is $5,000. So if she retires at the end of December without the waiver, she'll take out about $25,000 in severance. As opposed to with the waiver, it's going to be, I think you said, near $30,000 of accumulated time that she's owed for.
Well, that's including the payroll taxes, the retirements and everything, right? But it is a $5,000 difference, depending on if you grant the waiver, if the waiver is granted or the waiver is not granted.
I just say that, there are a lot of taxpayers that have difficult situations. And parting gift for $5,000 counting on taxpayers' time is not, I personally can't do that myself. That's my position.
Sure.
Just
Just for further discussion, whether we take it from contingency or the nursing home surplus or whatever, it seems to me that the county attorney has made a good case for exceptional circumstances for the waiver. So that's why I made the motion I did.
I have to tend to agree that, that waiver is in the contract, and it seems, the situation seems to meet the requirements of it. So, I guess I'm okay with it.
So how do we, if we want to take it out of the, what Representative Comfort was saying, take it out of the nursing home
Nursing home services.
services, we could just change from contingency to the nursing home services
Right.
account.
Right, we would just need the prefix for that line, and I would take it out of health insurance, which is 52,100, has $144,000 surplus.
Please don't take it out of health insurance. It's just clearly not health insurance.
Okay, so why don't we take it out of contracted nursing services? Or we can take it out of payroll tax and retirement, because
It's retirement.
Yeah, that would be fine. Any line that has enough money. You're in the nursing department, right?
nursing home services
Nursing home services.
specifically.
That's not the nursing department. I guess what is the first, if you give me the first one?
You didn't put them on here.
I didn't put them on where?
We don't have the prefixes on here,
On where?
on the budget you handed out. We only have the line item numbers, we don't have the prefix.
They're on mine, the first column.
First column shows the account number.
Yeah, that's all we have, is account numbers.
Oh, you're right, you're
Nursing
right, I'm
services.
sorry, okay. Nursing services, is that what you're talking about?
Nursing services, yes, nursing home nursing services.
And folks, I don't care where you take it out of, as long as you get it. Thank you.
I bet if it was your bank account, you'd care.
Well, yeah, no, of course, I didn't mean to be flip.
So you're talking, contracted.
Contracted nursing home services is
Well-
180,000 over surplus.
Well, he should rather us take it out of payroll tax and retirement. Retirement has a $23,000 surplus.
Contracted nursing services is fine.
Huh? Contracting nursing services fine also?
Yeah.
Okay,
Okay, so that makes it easy, but what is the prefix for that department?
It is 025140.
and it's 53301. Well, I think we need to talk.
Change the motion,
So the motion, yes, the motion was, I'll modify the motion. So it will not be as requested, it would be rather the transfer would be coming from the nursing home contracted services account 53301, 33,665 to the county attorney as detailed in the 4 different line items. Second, again.
Second. Again.
So. Gonna be.
any other comments? Call the vote, all those in favor say aye.
Aye.
Opposed? 4-1.
Thank you, folks, I appreciate it.
And, good luck with your mother-in-law. Didn't work out well.
When you get before I do the carry permit, right?
Thank you very much.
Thank you.
Nothing else? Need to
Adjourn.
go away?
Second.
All those in favor?
Aye.
Unanimous.
Oh.
Hey, very good.